Hi, and welcome to Berry Aftercare. You may be watching the video or listening to the podcast. Either way, I am super grateful that you are here. If you are a bariatric patient, or if you're anybody who has lost a tremendous amount of weight, if you have body dissatisfaction, or think you might have body dysmorphic disorder, today's the day for you to be present and listening to this message. I'm going to tell you why I'm doing this message, and it's interesting. As many of you know, I have been doing bariatric work for the last over 17, 18 years. And it's only in the last couple of years, one or two, honestly, that I've heard the word body dysmorphia thrown around. Prior to that, I didn't hear it in the community. So somewhere along the line, somebody decided that how they looked after having weight loss surgery qualified for the diagnosis of body dysmorphic disorder. So I'm going to clarify exactly what that is today, and I'm going to contrast the criteria for body dysmorphic disorder with negative body image because honestly, after doing some research and really looking over what the researchers are saying and what the criteria for body dysmorphic disorder is, I think the term is being used incorrectly. Maybe not in all cases, but I think in a lot of cases. It's sort of like when people say, well, I joke that I'm addicted to The Young and the Restless. Well, I'm not addicted to The Young and the Restless. I enjoy watching The Young and the Restless. But people say they're addicted to things, even though what they're describing means I really enjoy that. I like to spend my time doing that. But The Young and the Restless is not disrupting my life. It's not taking excessive amounts of time away from my family or my profession or my marriage or my dog, or it's not consuming my life, right? Like an addiction does. An addiction kind of takes over your life. You have consequences in many areas of life. So, like that, body dysmorphic disorder, I believe, is being used incorrectly. And I think it's important that we use accurate information when we're talking about things. So, I want to clarify what the actual criteria is for body dysmorphic disorder and what negative body image looks like because they're very close, they're very similar, and what distinguishes one from the other. So, I'm going to start with the actual criteria, the medical criteria for body dysmorphic disorder. So you can listen to this and you might think, well, yeah, obviously I have body dysmorphic disorder. And then I'm going to read to you about negative body image. And then I'm going to talk to you about some case studies and an article that I found about this exact thing, or at least part of the article was about do people following weight loss surgery who experience a lot of loose skin, don't like how their body looks, are preoccupied with how they're looking, do they actually meet the criteria for body dysmorphic disorder? So you can see why this is a really important topic and why you're going to want to encourage your friends and other people to listen to this episode for sure. So, body dysmorphic disorder is a mental health condition, and it falls in the category of obsessive compulsive disorders. Now, that's another disorder that's largely misunderstood. So, let me veer off for just a few minutes about obsessive compulsive disorder. When people think of obsessive compulsive disorder, they think, oh, they're a neat freak. Well, that may be part of what the disorder is, but compulsive disorder is much more than being a neat freak. There is a mental health condition of obsessive compulsive disorder, and there is an obsessive compulsive personality disorder. So, people who have obsessive compulsive personality disorders are the people who like things where they belong. They're the people who are like, have their house alphabetically arranged by soup labels and CDs, if they had CDs anymore, or back in the old days, the VHS films. And even before that, I don't even know what came before that. Yes, I do, but I'm not going to tell you because that'll tell you how old I am. However, it's the ultra neat freak, right? That's obsessive compulsive personality disorder in a nutshell. There's more to it, obviously. But the mental health condition of obsessive compulsive disorder is much more intrusive in a person's life. They're the people who are washing their hands until their hands are raw and bleeding. They're the people who might be picking at their skin and cannot stop and causing infection. They're the people who have intrusive, frightening thoughts that aren't based in reality. That's they may be based in reality, but they're bothering them to a level of preoccupation and anxiety that these people, no matter what you tell them, no matter what kind of, I say these people, I am one of them. I have obsessive compulsive disorder, a mental health disorder, and it is so consuming. It's not a matter of learning relaxation skills. It's not a matter of because these thoughts, even if you relax yourself, they just pop in, pop in, pop in, and it's exhausting and it affects your life in serious ways. So that's a term that people misunderstand. So when people talk about body dysmorphic disorder, it falls under the umbrella. It's closely related to an obsessive compulsive state that is really debilitating, that is runs your life practically, that causes you tremendous amounts of distress. Not like, oh, geez, I wish I could quit thinking about that. No, it's intrusive. I don't want to think about it. It's there. I don't want to wash my hands. It's not a germaphobe. It's a disorder. It's a mental health issue. So, body dysmorphic disorder is a mental health condition, and people have pervasive, that means constant and intrusive. It's like it won't leave me alone. Get this thing away from me. It will not leave me alone. Feelings about an imagined or slight flaw. All right, these are really important words. Body dysmorphic disorder is an obsessive, compulsive, and related disorder in which individuals have pervasive and intrusive feelings regarding imagined or slight flaws in their appearance, causing impairment in daily functioning. Impairment in daily functioning, meaning I can barely make it through work. I can barely get out of my house. I can barely go in front of people ever. All right. Here are the criteria. That's a description. Here's the criteria. And all of these must be met. All of these criteria. Preoccupation with a perceived flaw in physical appearance or a perceived defect in physical appearance. If a noticeable defect is present, the patient's perception is grossly exaggerated. So, for a lot of people who have body dysmorphic disorder, there is no real issue. They imagine it. Or if there is an issue, like they had acne, but now that they feel like they have to have the example I'm going to share with you is an actual case report. They feel like they need to have skin grafts. It's not, oh, you had acne, you have a few scars, which is true, but they feel like they need to have their skin taken off and new skin put on. It's an imaginary or perceived flaw. I just read another example about a girl who thought there was something seriously wrong with her ears, but the doctor saw nothing wrong with her ears. She'd consulted with several plastic surgeons. Her parents would have no part of paying for plastic surgery because there was nothing wrong with her ears. And her hair was covering her ears. So it's not like people could see this, but her perception of how critical that was kept her from doing anything social. She was in a psychiatrist's office. She was at the emergency room because she just couldn't get past how this was affecting her life. All right. Perceived defect or flaw. If it's noticeable, it's grossly exaggerated. The preoccupation results in clinically significant distress or impairment in social, occupational, or other important areas of function. So, like I was saying, my addiction to The Young and the Restless, which is not an addiction, did not cause clinical impairment in my life. I didn't lose a job because I was staying home to watch The Young and the Restless. I didn't get it. My husband didn't leave me because I was watching The Young and the Restless all day long. No clinical impairment. So with body dysmorphic disorder, there is clinical impairment, like the person completely, it interferes with their social life, it interferes with their job, it interferes with their relationships. That's how body dysmorphic disorder works. That's number two. The patient has performed repetitive behaviors or mental acts in response to the appearance concerns at some point during their disease. So they've tried all these cures for it. They've gone to all the doctors. They've done all these mental and physical things about this concern that they have, which remember is imagined or slight. The preoccupation is not secondary to concerns about body fat or weight that are related to a different disorder or an eating disorder. So those are four. All four have to be met. And then it can be with muscle dysphoria or without it. So with muscle dysphoria is they're preoccupied that his or her body build is insufficient muscularly. And that's more common for males, obviously, regardless of preoccupation with other body areas. So the disease usually begins in adolescence, about 16 years old. It has dissatisfaction with that beginning earlier in life. And so that may have started like at age 12. So this is not a common thing, right? So it occurs in 1 to 2.7% of the population. So 1 to 3 people out of 100 actually meet the criteria for body dysmorphic disorder. All right, let's talk more about what a negative body image issue looks like, because you're going to hear a lot of similarities. So when we talk about, then this article is about weight and body image issues, So let's talk about this body image, how you see yourself. And it's not just your physical self. It's not how you see yourself in the mirror or in a picture, but it's also your mental picture of how you view yourself. It's how you treat your body. It's how you feel in your body. So a distorted body image is also called negative body image, is an unrealistic view of how someone sees their body, right? It's more common in women, but it also exists in men. So a lot of times this too can start in early childhood, but it gets greater and greater as you get older. So there are some similarities, right? There's this unrealistic view of something. But remember, with body dysmorphia, it's not a real thing, it's a perceived thing or a very small flaw. For example, somebody might have a mole, a real mole, but in their mind, everybody who sees them is only seeing their mole. And they are obsessed with this mole. And if they think it absolutely destroys how they look, and they won't go anywhere. They've been to a lot of doctors. They can't find somebody to take it off. That's an example, right? That's an example. But with negative body image, here's the deal. Symptoms of unhealthy or negative body image. And this is going to sound very familiar because it's very much like body dysmorphic disorder. Obsessive self-scrutiny in mirrors, like you're constantly looking in the mirror. So there is a preoccupation with how you look. Thinking disparaging comments about your body, frequent comparisons about your own body shape and size to other people. You might envy somebody else's body. You might think your body, you know, is disgusting or flawed or hideous or so there's some similarities. But again, remember, it's not imagined and it's not a small perceived flaw. So after you have weight loss surgery, you do criticize your appearance a lot. You may be uncomfortable with your sagging body's parts or the extra skin, right? So there's a difference though. And anybody can have negative body image issues. And I think the truth is the majority of people have negative body image issues, right? People who other people would look at and go, oh my gosh, they have a beautiful body or perfectly gorgeous shape or whatever, whatever, whatever. But that person thinks, oh my God, my body is disgusting. How can anybody look at this? And, the self criticism, the self loathing. So I found an article, a research article, and it is in the Clinical Plastic Surgery Journal, and it's called Psychiatric Considerations of the Massive Weight Loss Patient. So they talk in this article a great deal about bariatric surgery and how people struggle with body image after the surgery. And they address body dysmorphic disorder in this article. Let me read it to you. Keeping in mind, well, they'll spell it out here. All right. While heightened body image dissatisfaction appears to be a common characteristic of cosmetic surgery patients, so this isn't just weight loss patients, this is anybody who has cosmetic surgery. Um, Heightened body image dissatisfaction is common among these people. I had eyelid surgery. I'm part of this group, right? Several studies have found that between 7 and 16% of plastic surgery patients meet the diagnostic criteria for body dysmorphic disorder. So 7 to 16% of people who have plastic surgery in general, and there's a lot of people. So the percentage of people who have body dysmorphic disorder, remember, is 1 to 3% in the population. Of those who have plastic surgery, it's much higher, from 7 to 16%. So body dysmorphic disorder is characterized by extreme body image dissatisfaction that contributes to a preoccupation with a slight or imagined defect in appearance, right? So, people with body dysmorphic disorder frequently seek plastic surgery and other appearance enhancing treatments. Listen to this. In contrast to people with mild to moderate body image issues, which is pretty much everybody, the vast majority of people with body dysmorphic disorder experience little change or worsening in their symptoms after surgery. So, the girl with the ear issue that I talked about a little while ago, even after her surgery, she would not find relief. She's more likely to be more dissatisfied because this is a mental health issue. It's not really an issue with body satisfaction. It's a obsessive compulsive issue with a slight or imagined defect. So here's what they say about people who have had bariatric surgery. All right. As the physical deformities found in most massive weight loss patients are not slight or imagined. So it's real. After you have massive weight loss, There are physical issues with your body. These are not slight or imagined. The diagnosis of body dysmorphic disorder technically cannot be applied to these persons. However, studies of patients undergoing other reconstructive surgical procedures, like for your ear or your nose or a mole or a whatever, suggest that they often report a level of preoccupation with their appearance consistent to body dysmorphic disorder. Thus, some body contouring patients likely present for surgery with some form of the disorder, although the exact percentage has yet to be established. So they're saying it may be true that somebody who's lost a lot of weight has body dysmorphic disorder, but it's not in relation to the massive and obvious and real changes in their body after massive weight loss. So you've got to figure out, do I have body dysmorphic disorder, which is probably not the case. I've worked with post-op patients for over 17 years. I worked in eating disorder issues long before that. Most post-op patients that I've met with in the last 17 years do not have body dysmorphic disorder. They have body dissatisfaction. They have low self-esteem in relation to their body image. It's a very different thing. And so it concerns me when I hear patients talking a lot about, I have body dysmorphic disorder. This body dysmorphia is real. Well, body dysmorphia is a real disorder, but I'm not sure the majority of people who, what? It says it ended. No, I think it's going. Here we go. Keep talking. Ignore that. We're still rolling. But I don't think the majority of people who have had weight loss surgery and are experiencing issues with how their skin looks, how they feel in their skin, how they don't like the sagging. And I don't think everybody who has um, plastic surgery or skin removal surgery I don't think they have body dysmorphic disorder. I think they're doing themselves a really nice thing by getting rid of extra skin if it's causing you ulcers, if it's causing you rashes, if it's causing medical issues. Get that skin taken off. If you don't like your arms, then and you have the skin removed, I am all for that. Now, if this turns into 13 different surgeries, or if this turns into, I hate this imagined or slight imperfection, and that goes on and on and on, then that can be a problem. And that's why plastic surgeons require, a lot of them, psychological evaluations prior to any kind of plastic surgery as well, because they want to know, is this a mental health issue? And is there a real issue with the person's ear or nose or whatever imagined disfigurement they might come up with? So be cautious and educate your fellow post-ops. Educate any professionals you hear talking about body dysmorphic disorder, if that's not really what they're describing. Because this is how misinformation is passed on. So again, all I can say is remember that only 1 to 3% of people actually meet the criteria for body dysmorphic disorder. And I will repeat, it's a mental health issue like an obsessive compulsive disorder that's pervasive. It crosses all areas of your life. There are a lot of intrusive feelings that you can't help, you can't stop. Unlike some of the body image issues, right? But we're talking about an imagined or slight flaw when we talk about body dysmorphic disorder. If you can't stand your skin or your body and you're having major body image issues after surgery, I get it. That is really common, and it's really common for people who don't have weight loss surgery. Body image is terrible for a lot of people, and it's related to all kinds of things in our society. You know, the magazines and the billboards and what we were taught growing up, the messages we got from our mom and the messages we got from our dad, or the messages we got in the locker room about our muscles or our breasts or our bellies or our thighs. You know, there's a lot of reasons for negative body image, but it's a different thing than body dysmorphic disorder. Now, I would suggest getting help for either. And you can do that with a counselor, a therapist, a psychologist. And the treatment of choice for both of these is largely um, cognitive behavior therapy. It's working on how you're thinking about this thing, having a more realistic view, realizing that your person, who you are, is not your body. And I tell people in group therapy a lot of times, think about the people who love you the most. Think about the people you love the most. If you think about the 5, 6, 10 people you love most in the world, and you think about the characteristics you love about these people, it's their attitude, or it's their humor, it's their appreciation of you, it's their intelligence, or it's their coping abilities to deal with life stress, or it's their, you know, their joie de vivre, the joy they bring to a situation, or what you love about these people. My guess is it has nothing to do with the size of their body. And the same thing goes for you too. The people who love you for what you bring to their lives. They love you for the qualities that you possess, for the person you are, for your personality, for who you are. So, it requires a lot of cognitive behavioral therapy, changing how you think about the importance of your body. And remember, there are over how many people? 7 billion people in the world. And I struggle with body image. I have my entire life, and it began around 6th or 7th grade. And it's been a struggle my entire life. And I've really had to work hard on this all of my life and come to the reality that not one person out of those 7 billion plus people are thinking about the size of my thighs at any given moment, right? Unless I'm standing in front of an audience and go, look at my thighs. Nobody cares. Nobody cares. Nobody cares about yours either. Sure, people are going to once over you and you go, oh, you know what? They're heavy or they're slim or they're tall or they're short or they're blonde or they're brunette or they're people do that. And then they're done and they're on to the next person. So don't hurt yourself mentally and emotionally by focusing on what you perceive as being flaws, right? We're human beings. Yeah, it's not an easy thing to overcome for sure, but it's your choice to dwell on it or to get some help to work on it. All right. So, probably you're not suffering from body dysmorphic disorder, but I can't say that for certain. If you really think that you are, go to a psychiatrist and or your primary care doctor and discuss the criteria with them. Because if you do have it, you want to get treatment for it. But if you, like most people, have some level, mild, moderate, or severe body image issues, I really encourage you to get treatment for that. The treatment is going to likely be the same in many regards, although there may be additional nuances given your specific situation. But get the help you need. I always say get help and get happier, for gosh sake. We're not on this planet for very long, so we might as well be as happy as we can while we're here. So, with that, I'm going to remind you it's your health, it's your responsibility this day and every day. And on Thursday, I'm going to do a quiz for body dysmorphia disorder. I'm going to do a quiz for body image issues. We will talk more about that. I'll give you some websites you can go to look at, and maybe we'll talk about some more case examples. And that will be part of your Berry Aftercare program. So if you're not part of Berry Aftercare, you can talk to your bariatric office and see if they'll pay for it for the entire population that they serve in their office, or you can join as an individual by going to www.berryaftercare.com and join and have all of the benefits of the Berry Aftercare program. Okay, my friends, I will see you hopefully on Thursday. Make it a great one. Please encourage people to listen to this episode. It's wildly popular topic and wildly misunderstood. All right. Thanks for joining me. Until next time, make